AI and XR-powered digital therapeutics for diabetes, hypertension, and cardiovascular healthcare in the not-so-distant future. Healthcare has transformed into a dynamic and immersive experience powered by artificial intelligence, AI, and extended reality, XR. This future is already beginning to take shape in the field of digital therapeutics, DTX, where patients managing chronic conditions like diabetes, hypertension, and cardiovascular diseases are stepping into a new world of personalized, proactive care. Let's explore the journey of these innovations and their impact on real patients' lives. Current status: AI-powered personalized health in today's healthcare landscape. Patients like Sarah, who is managing type 2 diabetes, benefit from a tailored approach that didn't exist before. Her life, once punctuated by daily blood sugar swings, constant insulin adjustments, and overwhelming meal plans, has been transformed by AI-powered DTX platforms. Her wearable device, which she barely notices anymore, continuously monitors her glucose levels, physical activity, and stress markers. It doesn't just give her data, it acts as a guide. One morning, after noticing her blood sugar spikes consistently after breakfast, her AI assistant sends her a nudge. Try adding more protein to your breakfast to stabilize your glucose levels. The advice is precise, based on patterns the system has observed over weeks, and Sarah takes comfort in knowing that her health decisions are no longer guesswork. Over time, her insulin doses have become more accurate, reducing the risk of dangerous lows and highs. With real-time feedback and lifestyle adjustments, Sarah's HbA1c levels steadily improve. For patients like Michael, who struggles with hypertension, AI-driven DTX offers a similar level of precision. His smartwatch tracks his heart rate and blood pressure throughout the day. When stress from work causes his blood pressure to rise, the app detects the spike and offers an immediate intervention, a brief guided meditation. After a few minutes of breathing exercises, his heart rate slows, and his blood pressure begins to stabilize. The AI doesn't just monitor, it actively steps in, helping Michael make better health decisions in the moment. In both cases, these AI-powered tools not only monitor but adapt to the patient's lifestyle, becoming a virtual health partner that empowers people to manage their chronic conditions more effectively. Behavioral and psychological support. Managing chronic diseases involves more than just physical health. It often requires psychological support. Enter DTX's behavioral science capabilities. Through AI-driven cognitive behavioral therapy, CBT, patients can address underlying habits and emotions that contribute to their health problems. Take David, a middle-aged man struggling with cardiovascular issues. His high-stress job and unhealthy eating habits contribute to his rising blood pressure. An AI-powered app guides him through daily lessons, helping him reframe his thoughts around food and stress management. David begins to recognize his stress triggers and learns new coping mechanisms, thanks to the app's integration of CBT. Over time, he replaces unhealthy late-night snacking with healthier habits, not through willpower alone, but because the AI has helped him reshape his mindset. With AI, personalized interventions meet patients where they are emotionally, guiding them to healthier behaviors in ways that feel natural and sustainable. The future of DTX. Predictive AI and immersive XR therapies. AI-powered predictive and proactive care. The future of DTX will not stop at monitoring and treating present conditions. It will predict future health risks. As AI evolves, it will analyze trends in a patient's data, predicting potential cardiovascular events, such as strokes or arrhythmias, days before they might happen. For patients like Mark, who has a family history of heart disease, this could be life-changing. His AI-powered DTX platform will track not only his current heart health but also predict when he might be at risk of a severe event, sending early alerts to both him and his doctor. These AI systems will also integrate genetic information, lifestyle data, and environmental factors, creating a holistic health profile that anticipates problems before they arise. Mark, empowered by this predictive care, will be able to make adjustments to his lifestyle and treatment plan, perhaps avoiding a heart attack that might have been inevitable without the intervention. XR-powered immersive therapies. Now, Imagine Mark's care extending into the realm of XR. After a particularly stressful day, he comes home and, instead of reaching for a blood pressure cuff, he dons a pair of XR glasses. He is immediately transported to a serene virtual beach, where the sound of waves and the sight of endless horizons help him relax. Guided by the DTX platform, the experience is more than just an escape, it's a targeted therapy. The environment is crafted specifically to lower his heart rate and blood pressure, designed by algorithms that respond to his real-time biometric data. In another scenario, XR could turn exercise into an engaging experience. Patients managing cardiovascular health, like Mark, could walk through a virtual forest, rewarded for reaching new milestones in their daily steps, or they could swim through a virtual reef, turning routine physical therapy into a captivating adventure. For patients with diabetes, XR could create interactive nutrition classes. Instead of reading about portion sizes or carb counting, they could physically engage with virtual foods, learning hands-on how to make healthier choices in a fully immersive environment. The future of XR and DTX means therapy will not just be effective, it will be engaging, intuitive, and even enjoyable, encouraging adherence through immersive experiences. Virtual health coaches and group therapy in XR. As AI and XR converge, the concept of healthcare will become increasingly humanized, even in its digital forms. In the not-too-distant future, patients may have virtual health coaches that feel almost as real as an in-person trainer. These coaches, powered by AI and enhanced by XR, could appear in a patient's living room, guiding them through exercises, giving real-time feedback on posture, or discussing meal plans based on the day's activities. Imagine a patient with hypertension struggling to stay motivated. Every evening, their virtual coach checks in, offering encouragement, setting new goals, and even offering a guided cool-down after a workout. This level of personalized care could make managing chronic diseases feel less isolating and more like a shared journey. Additionally, XR will enable virtual group therapy. Patients with diabetes or cardiovascular disease will be able to attend group sessions in immersive virtual environments, sharing their experiences, challenges, and triumphs with others facing similar health battles. These virtual spaces will offer a sense of community, connection, and emotional support, elements that are often missing in traditional healthcare settings. A future of empowered, proactive health. The future of DTX, enhanced by AI and XR, promises to transform the management of chronic conditions like diabetes, hypertension, and cardiovascular diseases. It is a future where healthcare is not just reactive but proactive, where patients like Sarah, David, Mark, and Michael are at the center of their care, empowered by intelligent, adaptive systems that help them live healthier, more fulfilling lives. In this future, AI-driven platforms predict health risks before they occur, while XR provides immersive therapies that make managing chronic diseases engaging and enjoyable. Virtual health coaches, tailored interventions, and group therapy sessions create a holistic, human-centered approach to care. Through these innovations, DTX will not only improve health outcomes but will also enhance the overall experience of living with and managing chronic conditions. This is the future of healthcare, where technology, empathy, and science converge to make a healthier world.